and I'm going to talk to you today about bunions. So bunions are caused by a number of different things. Genetics is probably the biggest part of it. However, types of shoes that you wear, activities, or other injuries you've had in the past could all influence the occurrence of a bunion or cause a bunion that's small to develop into a larger one. We get asked often if there's anything to do to prevent bunions from forming, and generally there's not a really great answer for that. Most of the time we try to have people to protect their feet by wearing good shoes and paying attention to any pressure that's being placed on the toe. If people do start to develop bunions, we start with the easy conservative measures first to hopefully avoid that from progressing, but that's not always successful. And sometimes if we end up going on to surgery, that will help to ensure that that bunion isn't as much of a problem down the road. Bunions are generally pretty painful. They start off mild and then can get worse. Bunions come in all sorts of sizes and shapes. So here's a bunion, and we've got the prominence on the inner side of the toe pushing out, and usually that's where people will have friction or that'll rub on their shoe. As that bunion forms, this metatarsal will start to swing over, and that allows the distal part or the furthest part of the toe to swing over, and usually you'll start to rub on that second toe. So that bunion actually envelops the whole process of all three bones with the joint in the middle. That's the biggest issue. As the bunion gets more symptomatic and starts to rub on your shoe, that's the time to start looking at things that we can do. So when we first start treating bunions, we start with a lot of the easy things. There's different devices we can use, some called toe sleeves or toe spacers. There's also bunion splints, which we can use to wrap around the toe to pull it over. They generally work really well when you're wearing them, but as soon as you take it off, the bunion can come back. So those are more for people who can tolerate wearing them in a shoe that doesn't interfere with their activities.
Bunions are a deformity of the big toe. The technical name or the medical name is called hallux abductor valgus. It is a deliberate, it's a painful condition where you get a deformity of the toe. Ultimately, it can lead to arthritis and many other conditions. It does have secondary problems, example, causing corns between the toe, difficulty to fit shoes. There's a great product to help this. It helps realign the toe. It can be worn with footwear, sensible footwear, but that doesn't mean you can't wear your normal footwear on occasions. It is a very comfortable device.
To help reduce the angle of the bunions, it can be worn during the day and it can also just be worn at night if people prefer. What I like about it is that it's easy to fit, it's well made, and it's got some silicone padding on the inside so it doesn't press into the skin and cause those horrible little compression divots that you get with a lot of other splinting devices. So a really nice, useful aid to help correct that bunion deformity.
People would probably be surprised at that prolotherapy is the best treatment option for bunion pain. You know, like, what is the best treatment for bunion pain? Most folks right away would think, go to a podiatrist, get a bunionectomy. But prolotherapy is very effective at getting rid of bunion pain. The question is, why does somebody get a bunion? Or why do you get the overgrowth of bone? The overgrowth of bone, including a bunion, is because the person has ligament injury in the big toe. You know, you could stub your toe, injure your toe, stretch your toe too much during a yoga class or doing some kind of pose or jumping, doing jump rope. You know, you injured your big toe, you injured the ligaments, now you got joint instability, so the body will overgrow the bone to stabilize that joint. So a better way to stabilize the joint is just get the ligament repaired. The treatment that best regenerates the ligaments is prolotherapy. Now, there are folks that wear those pointy shoes, especially gals, they wear pointy shoes, so you're forcing your big toe that way. So obviously, if you don't want to get bunions, don't wear really pointy shoes. Try to make sure there's enough room for your toes in the shoe. Like, make sure you can have your toes. So often what we'll do is we'll have people use yoga toes that spread out the toes, you know, like at nighttime when they're watching TV or they're just resting at night. prolotherapy is awesome for bunion pain. It's by far the best treatment to relieve the symptoms, the pain of bunions, and then the person doesn't need surgery and they can generally get back to all their activities.
I want to talk to you about a bunion and how you can best treat it. A bunion is a malalignment of the big toe joint. It occurs when the first metatarsal gradually moves toward the inside of your foot, and at the same time the big toe moves in the opposite direction. This leads to a large bump or prominence on the inside of your foot. A bunion is an inherited condition. In other words, you're born with a foot type that's going to lead to this problem. As a bunion develops, it can lead to significant pain and disability in the big toe joint. In the early stages of a bunion, you can treat this with some non-surgical methods. Wearing shoes with a deep and wide toe box will take pressure off of that bump or that prominence on the side of your foot and therefore help it to feel better. A doctor can make a custom shoe insert known as an orthotic device, which can also rebalance the front of your foot and take pressure off of the painful bunion. Unfortunately, as this problem continues, most people need surgery to have it corrected, and I want to help you understand when surgery is needed. So number one, surgery is the best solution for you if you're having pain on a regular basis. Number two, if your bunion is preventing you from doing the activities that you like to do and altering your lifestyle, then it's time to have your bunion corrected. In other words, if you like to run or dance and you can no longer do those things pain-free, it's time to have your bunion corrected. Number three, if you can't find shoes that you want to wear because of the painful bump on the side of the big toe, it's time to have your bunion corrected. And the fourth reason that I recommend surgery is if you start to develop symptoms of pain deep inside the joint, or if you have pain as the big toe moves up and down, that's a sign that you're wearing away the cartilage, the soft lining that separates the two bones, and it's a sign of arthritis. If you have those symptoms, it's definitely time to fix your bunion before the joint becomes too arthritic.
In order to correct a bunion, surgically, the bones in the foot, the forefoot, have to be realigned. Because of the bunion, there's an increase in the separation of the metatarsals. So in order to correct the bunion, the metatarsal has to be moved back inward. This can be done through a small incision made on the inner side of the foot. We do have the technology now to actually make the incisions sometimes even 3 and 4 millimeters wide, where we then drill through the bone from the inside out, making cuts in the bone both dorsally and plantarly. This allows the capital fragment, which is the head of the bone, to then be shifted over to realign the joint in a more proper alignment. This then allows the joint and the cartilage to function more efficiently with keeping the toe in a more favorable alignment. Bunions typically do not return after surgery if the bunion is corrected properly, keeping in mind that a bunion is an angulation between the first and the second metatarsals. If there is just a bump that is shaved off from the inner side of the metatarsal, then the bunion can reoccur because the angle of the metatarsal was not addressed, and that angle can increase over time. So by correcting the angle, making the bone align properly by cutting through either the head of the metatarsal or the base of the metatarsal and bringing the joint into alignment, this ensures that a bunion does not reoccur.
Let's see, other things that people ask me. Sedation, do you have to go to sleep to have bunion surgery? No, you don't. They will start an IV, get a little medicine in there, and makes you kind of drift off to sleep so you don't really know what's going on. We numb your foot up, and then you're kind of awake, but you don't really remember what's going on because of the medication that you've been given. But you have no pain during the procedure, and most people do not remember anything. from the operating room experience. They wake up, their foot is numb because of the medication that we use after we're finished. We numb the foot back up. The foot's wrapped up in a big puffy bandage, and you stay off of it for the first few days. Then we'll see you back in the office, and most people with a typical bunion, what we call a mild to moderate bunion, where we do the head procedure, where we get a screw or a staple up in the front of it, we'll be able to start walking on that foot relatively quickly in what we call a cam walker, which is a boot that protects it. It's like a walking cast. And that boot you stay in until you're able to get